Good afternoon, everybody. Today is February 25th, 2022, doing our weekly COVID-19 update for the town of Falmouth. My name is Scott McGann. Our website's falmouthma.gov. Our email is health@falmouthma.gov, and our phone number is 508-495-7485 if you need to talk to us. We have 4,052 cases during, these are all PCR tests, positives. There were 31 this week, 12 probables. None of this counts the home tests. Falmouth's 14-day incidence rates dropped from 26.8 to 16.3, and a positivity dipped below 5 to 4.68, which was previously 6.14. And that's between the time frame of 2/6 and 2/19, because the state does the 2 full weeks prior to the Thursday posting. So it gets a little stale, but the numbers have dropped. So our numbers were 32 last week, so we're pretty much similar from the week before. If you can see in the far right, the 2 dots are kind of close together. But it indicates more of maybe a start of a baseline of where we are after we've had that huge spike with Omicron cases. So in terms of PCR, 32 last week, 31 this week. This is our flattening the curve chart that we keep going. The flatter and more bunched the dots are together, the better we're doing. You can see they're spread out, they're rapid that we had during the Omicron surge. We're starting to flatten back out to sort of more normaler times that we get. So that's where we are as far as cases are concerned. This chart's a little old. I haven't seen an update from Barnstable County. So with hospitalizations, and this chart is usually provided on the county's updates, and I just take it right off their site. So I don't have an update because that is the most recent one. It's the same one I used, I think, the last couple of weeks. I'm sure it's somewhere down sort of a similar number. I think, maybe in that 60 or so range for every 3 days is probably somewhere where we are. Statewide, it was like 20-something hundred last week. It's 1,500 this week. 512 in the hospital, 97 ICU patients, 48 deaths. The deaths are going to be high because it's when someone goes to the hospital with Omicron in January, it does take time. People are on vents and things of that nature. So I think these are the numbers that are more indicative of the higher counts that we had previously. Vast majority are unvaccinated that end up in the ICU or worse. So all our trends are on a downward. You can see the downward trends that continue. I pulled this chart out because I don't have really great hospitalizations. The actual number for this week from the county. So this is from January to February, shows the decrease in hospitalizations from 3,105 on January 2nd to 512. The 2 different colors indicate incidental and primary. So the primary cause of going to COVID is in dark blue. Okay, so it stays right. It's less than the number. That percentage actually drops a little bit, but it's at 42 and 58. So 42% of the 512 were as a result of COVID, and 58% were incidental. So that's, again, all showing an indication of the good vaccination rates that we've had in the state, and also that Omicron is not quite as bad as far as hospitalizations as Delta, and so you're sort of seeing that in the hospitalizations. Again, this chart is 5 and 1. It's an old stale. Again, as soon as if I had a new one, I would put it up there. I just don't. In terms of where we are for incidence rates are what all these towns would have if it had a population of 100,000. So Falmouth, if it had a population, would be averaging 16 daily cases during that time frame of February 6th to February 19th. So that gives us about 5 cases per day. 5.5 cases per a little over 5 cases per day was the average over that time frame. 35 a week. So when we end up with 30-something cases, we'll have an incidence rate somewhere around 15. And that number is definitely down, like I said before, down from going back up from 26.8. So it was 40 the week before. So you can see the drop off, and then it's going to level. It looks like it's going to level out a bit to some number, probably 10 or so, or something like that. So we'll see. Our positivity dipped under 5, which would be low for the first time in quite a while. We're sort of middle of the road. Some towns have done as well. The entire state is still lower than the county as far as percent positivity. The cases of fully vaccinated individuals, this is always I call the silver lining. The silver lining to vaccinating is that there's slightly higher on both these numbers for whatever reason. I think, it dipped a little bit lower. I think 1.4 something was the lowest number. The highest when it first started to do this was about 4%. So when it was Delta and everybody had been vaccinated in the spring and we're in the fall, they put this chart up in the fall. We hadn't really got into boosters yet, and we were dealing with Delta, so the hospitalizations was closer to 4%. So right now it's 1.61. So what that means is out of the 447,200 cases, 1.61% get hospitalized, and 0.5% end up in death. Of all vaccinated individuals, 8.5% breakthrough. So 8.5% of all vaccinated individuals have had a breakthrough case. Of all the vaccinated people in the state, 0.14% have been hospitalized. That's very low. And 0.04% deaths among the entire population, when you look at the entire population of vaccinated individuals. So those are all good signs. And we'll tie this in a little bit when we discuss mandates and mask wearing and so forth. Our vaccination rates, again, we gained 277 first, second, and booster doses. Roughly 60% of our fully vaccinated individuals have been boosted. I think some of these numbers, the high numbers of at least one dose, initially they were counting them as first doses and they should have been counting them as boosters. There might be a little bit of overlap, like where some of the numbers for boosters might lie in there, but we'll never know because we get this from the state. But again, robust vaccination numbers, we make small gains. Looks like most of our gains were in the 5 to 19-year-old age group over the last, this data is as of 2/22. As far as vaccine availability, again, vaxfinder.mass.gov, there's plenty available vaccinations, whether you're going to choose a pharmacy, so the private sector or public, as far as the Barnstable County Health Office, state, the community college. Check the Barnstable County website. This does change a little bit. I I didn't see any changes when I looked quickly, but do double check the website as well, so barnstablecountyhealth.org. But vaccine availability is quite readily. It should show up on VaxFinder no matter what. Homebound, those individuals that cannot make it to the clinic, we have not had a call in some time for homebound doses. Again, call the health department, the 495-7485, or email us, and we'll put you in contact with the VNA, and that'll get scheduled quite quickly, so just let us know. Testing, again, a lot of home tests around. Test and stay is no longer at the schools. They're using more of a pool testing, home testing strategy from DESE, the Department of Early and Secondary Education. Testing, again, the pharmacies, Convenient MD, the hospital's still doing it. The fairgrounds was using the Cape Cod Church. Not a lot of activity there. It's almost not, we're getting a half dozen or a dozen test requests. Community Health Center, especially if you're a patient, you get home test, and the Stop the Spread site, again, at the Melody tent is free. So there's plenty of opportunities for testing. Face coverings. So townwide, we were in a mask advisory that's still for all indoor public places, that still remains. The school committee voted not to implement a mask mandate after it expires on the 28th. Okay, so going into March 1st, it will be not a requirement. Still can wear one, just not a requirement. Town buildings, the select board adopted a mask requirement after the Board of Health recommended they do so on town-owned properties. That is still in effect. The select board believe will be taking that up on Monday. They will not have a Board of Health recommendation just because our board doesn't meet till the 7th. We had to skip a week due to quorums and things of that nature. So our next meeting is not till the 7th. Will be taken up by the select board on Monday. The CDC is supposed to today update the guidance. So under the current guidelines, the agency recommends that anyone living in an area with substantial or high transmission, which is the chart I'll show you next, is defined by case count, should wear a mask in public indoor spaces like blah, 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 so all indoor public spaces. So that means that people living in 95% of the counties in the United States should be still wearing masks, because that's a very tight metric. Actually, the state never adopted it, the one that I'll show you next. We've been using it because we didn't really have anything else. But as it stands, that's going to supposedly change. They're going to look more towards hospital capacity and COVID-19 hospital admissions, rather than simply looking at case counts, because the vaccine works. The most recent variant is a little bit weaker. It's not about case counts at this point in time. It's more about the severity of the disease, not the frequency of the disease. So I'll post that for next week. Any updates may get on the website as well. It should be in the news today. They're supposed to do something today as of like 11:30. I looked at it. I did not see it. So they're going to change their guidance, and I'll relay that to the select board on their meeting on Monday on what the updated guidance for the CDC is. So it's getting more away from mandates and things. And why? Well, you know, in 2020, we were wiping down our boxes from Amazon and so forth, and we're not doing that anymore. And we were dreaming about getting a vaccine, which we got. You know, we were hoping for a variant that wasn't as strong as the original. We kind of got that too. The vaccines worked, so we have treatments coming in. Paxlovid is. The state just had the state might have a state call every Tuesday with all the health agents in the state, and that is right here upon us now. There's a couple other different treatments that are out there, so the future's bright on that. And you know, all these measures were supposed to be temporary until we got to that point, and at some point we have to say we're at that point. And of course, we would need to pivot if things change or a new variant comes out that's more severe. But I think as of now, well, I think the CDC is not going to is going to get rid of this in some way, shape, or form. I don't know how it's going to be worded. And I will give that to the select board when they deliberate town-owned buildings. Schools have already made the decision, and that's sort of where we are with that. So, again, this chart I think I'm going to stop using eventually. Dr. Katie Brown is the lead epidemiologist at the state. She's on the call every Tuesday that we have in the afternoon. And of everybody that I've, if anybody I trust on things, it's her. She's done a great job on it, just giving us the facts and not anything else. That this is a real strict measure. And it really, when you take your daily incidence rate and you multiply it by 7, it's going to be really hard to be low. You know, you'd have to have one case here and there just to get to the low or moderate. You really have to have a very, very, very low case count. And I think this has not been adopted. This was never adopted by the state. I decided to look at using this in the Board of Health just because we lacked other things, and I think we started this in the summer. As we stand now, we're in low for positivity. We're in high, and we'll be substantial or high if we remain at 20, 25 cases a week. That's going to keep us in the high range. So we would need an incidence rate, a very low incidence rate, to get anywhere in here. And actually, Dr. Brown thought that was a very severe sort of metric, a very hard to meet, expectation. And so I think I'll start dropping it because we're not really using it for our decisions. State doesn't really necessarily think we should be using it for our decisions. She brought this up, and I happened to say, I'm kind of the only one I thought using it, but maybe other towns were using it. So that's kind of where we are with that. In terms of hospitalizations, I don't have fresh numbers. I think we're doing pretty good there. And again, our vaccinations were. So we were supposed to look at all of this to make determinations, and whether we did or not. I think when we got Omicron in, the board recommended it, not everywhere, as a result due to the high case counts. It's just that it's high. The bar is really, really hard to achieve with the sort of current way that this sort of might be a little dated. And again, as a recap, our case counts have significantly tapered off and seem to have leveled out because we've had 2 weeks of almost the same case counts. They're all Omicron. We still have vaccines around. Anybody over 5 is eligible. There is some new information coming down. I just didn't, about having 4th doses. Those who are severely immune compromised going through a 4-dose regime of 3 doses initially by the 4th for a booster. That information, I'll see if I can put that together in a slide for next week, but you can always check the CDC recommendations on their website for changes in vaccine eligibility. Boosters have been available. It's real easy to get. Today's weather, it's real snowy. It's Friday. If you ventured out today, there's probably plenty of openings. There's been openings real quick. So if you change your mind to get vaccinated, this would be a good time to do it, or boosted. And again, new CDC mask guidance today-ish, because I don't know what time it's going to come out today. And then, I'll discuss that with the select board on Monday night. So that's what we have for an update. Good news. And I'll see everybody again next Friday. Thanks.